Hi guys, welcome to my channel. If you're new here, thank you so much for stopping by. If you clicked based on the impression you got, I'm really grateful. And if you're a returning subscriber, thank you so very much. I really do appreciate you returning back. I guess you must have either seen the link to this very video or all the videos I've been posting out there, or you must have turned on your bell notification, which I always say, like, turn on your notification so you always get notified whenever I upload a video on here. So if you have done that and you keep returning to watch all of my videos I upload here, thank you so much. I really sincerely do appreciate. So guys, I'm talking about some very important topics today. Number one, how you can avoid swelling during pregnancy. Number two, soft spot on baby's head, what you should know about it. Number three, as a new mom, the people that you should avoid. Yeah, so that's what I'm talking about today, so stay tuned and don't go anywhere. So yes, how to reduce swelling during pregnancy. I'm going to list like 8 points. Number one, always sleep on your side. Laying flat facing up can cause complications, and also because of your bump you won't be able to lay flat facing down, so it's always advisable for you to sleep on your side. And the best side you can sleep on is your left side, because it aids easy digestion and a lot of other things. So sleep on your side, that's number one. Number two, try not to cross your leg. You're pregnant, you need all the air in this world to feel at ease, because pregnant women sweat a lot. They always get uncomfortable wearing tight clothes, uncomfortable wearing or being very close to someone. They just want a breeze, they want air. So crossing your legs, I know you are trying to be all ethical, you're trying to be all posh and all that. Try not to cross your legs. Number three, try as much as possible not to wear tight shoes. During pregnancy, everything in your body grows bigger apart from your eyes. Maybe apart from your eyes or your ears, I don't know. Yeah, but everywhere just grows bigger. Your hands, your feet, especially your feet, and then your nose. My goodness, a lot of women experience this. So avoid wearing tight shoes so that you can allow the free flow of blood. Number four, reduce salt intake. I mean, even those that are not even pregnant, even men, they will tell them to stop taking too much salt. Moderation is the key, so always try to reduce salt intake. You are pregnant. Number five, this number five is very important. Always stay hydrated. Drink a lot of water. When I was pregnant, I had this big bottle. I used to always use that bottle. I used to drink water. I love drinking water a lot. I used to drink all of this. In fact, this is even too small. I bought this so that I could keep track of my water intake. Written on it are several things, from 7 a.m. to like 9 p.m. But I even still drink water at night because I will always go to the toilet to pee and I want to stay hydrated. I will feel thirsty and I will take water. So I like what the words written on it. I'm going to read it. I got this because of the fact that it was written in pidgin. I love pidgin. So in the morning, 7 a.m. it says good morning. 9 a.m. it says you fit do am. 11 a.m. it says how body, drink more. 1 p.m. it says no shaking, nothing do you. 3 p.m. it says you don't dey halfway, which means you are doing well. And then 5 p.m. it says like play, like you are doing it. And 7 p.m. it says remain small. And then 9 p.m. it says na boss you be, you've done a great job. So guys, this is like this is very good. If you can, I think you can get it, they sell it everywhere, so you can get it, or you can either just make sure that you have bottles of water, whether it's Lacien, Seaway, Eva bottle, whatever brands of water you want, or you treat your water in your house. Always fetch in a bottle and make sure that you stay hydrated. Very important. Pregnant women need water all the time. Number six, always make sure that you raise up your feet. So put up your feet whenever possible. Every time I go to the salon or whenever I'm somewhere and I'm seated, I know that I'm going to be seated for like a couple of hours. I'll always request for a small stool or table and I just put my legs on top. It helps a lot. Whenever you know that you're going to sit for hours, always make sure that there's a small stool or table right in front of you where you can place your feet on. You'll be very, very comfortable. Number 7, I also feel this relates to number 6 as well. Make sure that you always sit and walk, like alternate sitting and walking. So take regular breaks from sitting and standing. So whenever you know that you've been sitting for so long, try to get up and just take a walk to wherever, not so far. If your pregnancy is still in its early stage, not so far off, just make sure that you at least exercise your body, allow your body to feel light, not sitting down in one place from morning till night, or standing and doing like a strong woman, because when you stand for too long, it's going to affect the bottom part of your tummy, and that could affect your baby as well. So these are the points that I have for the reduction of swelling when you're pregnant. Try as much as possible to follow these tips, and I promise you, if you have problem with swelling, it's going to reduce or it's going to stop totally. Now let's go to the second topic for today: baby soft spot. Some people call it oka. I think the English word for it, or is it really an English word, is fontanelle. So guys, I don't know if it's an English word or I don't know what word it is, but I heard it when I was in the hospital. They call it fontanelle. I'll just leave the spelling right there. Anyhow you want to pronounce it, that's fine. I didn't check how to pronounce it, but the nurses there pronounce it so well. Some people call it oka, but then it's this part of the baby's head. So when you give birth to a baby, the baby's skull is soft, so the individual pieces of their skull is not fused together yet, allowing them to fit through the birth canal so that it can come out easily. So when the baby comes out, there is like a soft indentation on top of their head here. I know most of you must have seen it, and most of you must have been wondering, oh, what's it for? Oh, why is it like that? Oh, will it ever like close up? Would it ever would it remain like that? Or so many people have questions on this. So when a baby is born, like I said earlier, there are 2 soft spots. One is the front indentation and the other at the back. The other one at the back is not so obvious, it's not so noticeable, and that one takes about, I don't know, I think when your baby is like 3 months, 4 months, you don't see that one anymore. But this one might take a longer period of time. Probably when your baby gets into like 2 years, then it starts to close up, or 3 years. But I think before your baby clocks 2, the one here, the front indentation here, begins to close up, and then close up finally, like it's not noticeable, it's not obvious. When I had my first baby, my mom would always put oil on it. She would pack oil on it, and she would say, yes, that's how it's meant to be, so that she would comb it and all that. Me, I didn't understand. My first pregnancy, what do I know? She's a mom, she's a grandmother, and mine is not the first, so she's experienced. I just let her do her thing. But when I had my second baby here, most of the experiences I have that I'm relating here is because of this my second baby. I had more experience, like I have more knowledge now about certain things. So when I had my second baby, I got to know that, you see that thing that they pack oil on top here, it's not good. Mothers or grandmothers, please just allow the baby be. Do you know why? Because I noticed that my first baby started having rash. So I don't know if the nurse that told me this is right, but I mean, like, it's their profession, right? So she said that whenever they put oil on top here, like you pack oil on it, it can cause rash. It can cause rash on the face, and then eventually it can spread all over the body. It's not like it's not going to go. The rash will definitely go. This is not baby rash I'm talking about. There's some very weird rash, according to the nurse here, that just appears on your baby, and it happened to my first baby. At some point when that rash was appearing, I told my mom that I don't understand this rash. This is very weird. I don't like it. Like, whenever I see babies that have rash, I feel sorry for them. So I never thought that my baby would have rash. I just felt that, everything is going to go normal. So when she started having rash, I told my mom about it. Something, mothers, they will not be scared in front of you. They will be like, don't worry, everything will be fine, okay, leave it, it's baby rash, it will go, just give it a few days. Not knowing that my mom was worried. She would go to her room and she'll be like, this rash, I've not seen it before. She told me this when we passed that stage. It can cause rash, some very weird rash. It's not good to put oil on it. Some people will mix concussion and all that to pack on the head. I recently saw somewhere that it can even cause infection. So just let it be. If you are watching this, you are a new mom and somebody is telling you that, oh, there's one concussion somewhere, or there's one concussion that helps my baby, put it on your baby's fontanelle, put on your baby's soft spot, it will close up, it will do everything. It's not going to do anything. It might even cause damage. It might cause damage. There are some persons that are so ignorant that they'll be like, it's a lie, I did this for my first baby. No problem, don't drag somebody else, because what works for you might not work for another person. Just let it be. Just let the baby be. Or better still, go and meet your pet, go and meet your doctor or the baby's doctor and have a conversation with your doctor about whatever you feel worried about concerning your baby. So always look out for the soft spot. What I feel you should do, or rather notice, is when the soft spot is now like getting deep, like going inside. Yeah, so you should always look out for it. Once you notice that, it's a sign of dehydration. Probably your baby is dehydrated and your baby lacks water or nutrient or something. So yes, you can give the baby, if the baby is up to 6 months, the amount of water he or she is supposed to take. If the baby is less than 6 months and you are giving the baby water, there's also a particular amount that you are supposed to give the baby. I don't know about that because I did exclusive breastfeeding for my kids from the very day they were born to like when they were 6 months old, and then I introduced formula and the rest after 6 months. So if you want to give your baby water before 6 months, I feel like you should talk to the doctor about it so that they can tell you the exact amount of water you should give your baby. Don't be giving your baby water like as if the baby just came from desert or somewhere. Also, if you notice that it's swelling, it could be a sign of infection. If you notice anything strange about that soft spot, just take your baby to the hospital straight up. Don't wait for, they are going to miss one concussion, or they are going to give me one thing that I will use. Don't wait for all those things. Just go straight to the hospital and lay the complaint to your doctor, or to the baby's doctor rather, and yes, they'll take it up from there because doctors have more experience. Read about it too, because there are some times that several times I've read about some certain things that have happened to my babies, and I walk to their doctor and then I ask a lot of questions, and then these doctors will be like, oh, how did you know about this? I like the fact that you're asking questions, because most doctors, not all doctors anyway, most doctors like it when you ask questions, when you want to know. It's not that this Nigeria now, most doctors are frustrated because of their little pay or because of how they are being treated. They love their job. I can see from several of them, and they like it when they impart knowledge to others. So ask questions, read up about it before you go and hear what he has to say or she has to say, and ask questions if you are not satisfied. To get satisfied, get the necessary drugs or medications and take it up from there. So be careful, new moms, when you have a baby during that omugo period. So many advice, so many people come to visit you, and that's what I'm talking about next. So many people come to visit you and they'll be like, oh, don't do this, oh, do that, no, don't do the baby like this, do the baby like that, so many advice everywhere. Be very polite, but block your ears. When they just be smiling, especially when they're old people, it's not good to be disrespectful. Allow them say whatever they have to say. Ask questions, just to keep the conversation going, so that it doesn't feel like, oh, you're not answering them or you're being so rude to them. And then let them, when they leave or they go, you continue your life. Yes, you continue your life, because if you listen to every talk, this one will come and say, bathe your baby like this one will come and say, don't do like this. You are going to damage yourself and damage your baby, and it will lead to depression. You don't want to deal with that. Because see, let me tell you, as a new mom, if your baby is not feeling fine, you will be so worried. It will tell on you. So be careful the advice that you take in. Now we're moving on to the last topic for today. People you should avoid as a new mom. There are people that you should avoid, or you should politely tell them to leave. Okay, don't tell anybody to leave. That would be very disrespectful. Just let them come, say whatever they want to say and go. Do not take their advice. These are the people that you should avoid. One, the ones that will come and plant kiss on your baby's forehead or your baby's cheek. I don't like it. If you are watching this and you are going to visit a new mom, please do not, don't kiss the baby. Don't kiss the baby. Why are you kissing the baby? I know that there's some babies that can be very attractive. They're so soft. Babies are so cute. You know, that's so, some of them are chubby. You know, very, oh my God, Jesus Christ, babies are so cute. Do not be tempted to kiss the baby on the forehead. Okay, maybe some people will let it. On the lips, that's a big X. That's a no. Don't kiss people's babies. Reduce the kissing. The baby is still very tender. Bacteria, infection, everything can just catch that baby, even though the baby have been giving BCG. Honestly, there are even some babies that I used to think that when they give birth to a baby, that very day they give BCG. There are some hospitals that will wait for a while. Maybe BCG is not available at that moment, and they will give the BCG like maybe a few days time. People come to visit that baby. They don't let people touch that baby in the hospital because that baby has not taken BCG and that baby is exposed. If you've been doing that, please stop doing it. And if you are a new mom, please don't let people kiss your baby. You can just politely, you know, and discreetly just let them know that, oh, please don't kiss the baby yet, you know, that kind of thing. You that is even going to visit, have it at the back of your mind, like kissing of baby is not allowed. Yes, don't kiss babies. Number 2, if you are coughing or you have catarrh, don't go and visit. Yes, don't go and visit. If you know that you have things to drop for the new mom, wait till you are very much okay. Don't visit when you have cough and catarrh, because you can, it's a contagious disease. You can spread it. You can give it to the baby. And imagine if a newborn is coughing or having catarrh, you don't even want to see it. It's not a good sight when you see babies that cannot breathe because of catarrh. Maybe at night or during the day, you see catarrh running out from their nose, you see them coughing. I just feel like they must be experiencing a lot of pain here on their throats, you know. So if me as an adult, I feel sorry for the babies because I know how it feels like to have catarrh and cough. Imagine how the baby that cannot even talk or cannot express himself at that stage or herself at that stage is feeling. Don't go and visit somebody when you have catarrh, when you have cold, when you have flu. That's not thoughtful of you. Then avoid people that will be asking you, did you give birth via CS or is vaginal birth, to know if you are strong or if you are weak? Why do people even ask that question? I don't know. I just feel as long as mother and baby is doing well, they are fine. That's what you should ask. How is the mother? How is the baby doing? Oh, perfect, they are fine. Oh, okay, that's great. Not like how you take born. Now yeah, she use take born. I be they use knife take cut your belly. What are all those things for? Whether you're my friend or not, I don't know how to react. Probably I'll just keep quiet. If you are my close pal, I'll curse you straight up. Like I will just start, you know, my close friends can tell. I'll just start yarning some kind of things that you said, you know, that question doesn't make sense. And then let alone if you're not close to me, you're just a stranger and you're happy for me. You come to me, you greet me, you like, oh, well done, you know. Then you not ask, now yeah, she use take bone, I been a knife. I don't know how I would react. I really don't know. So if you've been doing that before, stop doing it. Don't do that. That's very bad. Don't do that. Don't ask. What are you asking for? You want to know how the size of the baby's head was before it came out? Or you want to know how many layers they opened before the baby came out? Or you want to know how the what please, new moms, avoid people that ask this kind of questions. If you notice that the conversation is going that way, just polite tell them, please, I would not want to talk about that. Can we talk about something else? You know, or you can just tell them, or you can just maybe ignore the question and say something else. I do it a lot. If you ask me something that I don't want to talk about, if for example you ask me, oh, did you give birth via CS or vagina, and I might be like, did you see that movie last week? That movie was the bomb. Oh God, I love that movie. You that ask me that question, you'll be shocked and you'll be so ashamed of yourself. So just be happy. Just go, be happy. Carry 1 or 2 things with you. Give to the baby if you have. If you don't have, visiting alone is enough, you know, and go home. Then before you even touch the newborn, make sure that you wash your hands or you sanitize your hands. There's something that someone came to visit me when I had my second baby, and I really loved what she did. Although yes, we got used to the hand washing and sanitizing because of COVID, but I feel like if it's in you, it's in you. You know, there's some persons that till date they've not been vaccinated, they are still talking, spit is coming out from their mouth, and they're not wearing their nose mask. They're still even looking at those wearing their face mask like, this one is inviting COVID and all that. All kind of people, I don't used to come close to them more. When the lady came to visit me, she requested for hand sanitizer, and she brought some very good, nice clothes for my baby, and she carried the baby for a short while, and then she handed the baby over to me. Okay, I think because baby was hungry anyway, but then she handed the baby. That is just simple and easy, very sweet. I enjoyed the visit. It's not the one that you come with your hand that you have put inside your nose, you picked your nose, or if you eat your bum bum or your armpits. Oh my god. I feel faint. I feel just. And then you're not able to carry the baby. You know, when you have a baby, that's the time for you to now see. I used to be like that. I used to be like, oh, I don't want the person to feel bad, especially if the person has been married for a while and the person doesn't have a baby, and the person comes visiting and the person displays all these traits that I said that you should avoid right now. Before me, I used to feel like, oh, I don't want the person to feel bad, so take what? When the person goes home, I'll be the one suffering. Like, I'll be the one running the hospital, like having appointments every now and then. You know, so I feel like you should tell the person, please, can you wash your hands? Or please, can you sanitize your hands? It's going to be very good that you wash, don't sanitize yourself. Wash your hands, you know. And if person says, for waiting now, waiting there, use hand, take clean trouser or clean shirt. Please use the door, close it behind you. You know, just politely tell them that they should wash their hands before carrying your baby. Some people will tell you to apply urine in your baby's eyes when the baby has eye infection. Please, anything infection, anything strange, I keep saying it, I've been saying this from the beginning of this video, go to the hospital. I even remember years back, mothers, they used to tell mothers to press out milk from their breast and put in the baby's eyes if the baby is having like maybe you know, if there are like substance coming out from the baby's eyes, they will tell the mom to do that. Well, maybe that time it works, but I don't feel it's, to me now it's like, why are people really doing that? You know, my mom even did it. I did it, not like my mom, sorry guys, I did it for my first baby because my mom was like, do it, it's like eye drop. Mommy's kololo. Mommy said it's like eye drop. Me self now. What did I even know that time? She's my first baby. I really went to press out breast milk, put in my baby's eyes. But you know what, guys? Funny enough, it worked. So funny enough, the next day I didn't see all those things, all those foam-like substance in my eyes anymore. Everything just wiped out. But you see this urine? Somebody told me, I think a year back, and I was shocked because I haven't heard of that one in my life. The only one I've heard of is this breast milk. So I don't know about breast milk shower. The doctors in the house, guys, you guys comment please. Is it advisable? Because I still feel it's not. Just go to the hospital, meet the doctor, and they will have their findings and their ways around it, medications for the baby and all that. So yeah, I think that's it. Although it helped my baby, but I wouldn't do it then. I wouldn't do it now. I wouldn't do it now because, like I said, life has changed. Let's not look as if it's the time that you go to the hospital and they will say, madam, what did you do? I just put breast milk in his eyes. Why did you do that? They will not say that it's that breast milk that you put inside the child's eye that made the situation complicated. So you wouldn't want that. So be on the safe side. So these are just a few points I have today for you guys. So please take note of these points. You know, if you have additions to whatever I've said, please drop it in the comment section below, and yeah, I'll definitely reply. And people that read comments definitely learn from whatever comment that you have that is, you know, encouraging as well, and that would help them when they eventually have their baby. So we have come to the end of this video. If you like this video, please give it a thumbs up. Please give this video a thumbs up, guys, please. Also, if you haven't subscribed yet, just smash the subscribe button, and also turn on the bell notification so that whenever I upload a video on here, you get notified, and yes, you will be able to watch my next video and yeah, enjoy it as well. So guys, don't forget, next Friday I will be answering all the questions that you have asked me on Instagram. We still have like a week to go. Yes guys, we still have like from now to like Friday next week, and for you to drop your questions. Please, any question that you have relating to the topic I talk about, or relating to what I talk about here, or something personal, go easy on me guys, please. Please follow me on my Instagram. I'll leave the link to my Instagram page in the description box below. Just check it, and when you click on it, it takes you straight to my Instagram profile, and check my Instagram story. You see where you can ask me anything. You can send me a question, send questions to my DM, or you can ask me straight by just clicking on the ask me anything box and type whatever question that you've been wanting to ask me. And if I have answers to it, or if I have experienced it, I will definitely answer all the questions that have been dropped. I will try my best to answer them. So don't forget, next week Friday is my question and answer session. So guys, I will see you all next week Friday. Next week Friday, I'm not going to talk about anything. I'm just going to be answering your questions. Like, send me all your questions, loads and loads of questions. I'm waiting guys. I have quite a number already, and I'm expecting more. From you guys. Please ask reasonable questions. Please guys. Until next Friday, it's bye for now. Mwah. I love you guys. Bye.